We welcome you to this special edition of Health and Family. We want to learn as much as we can regarding the Zika virus. Now that Bermuda has experienced imported cases, we hope to answer additional questions with regards to how this disease is spread and what is the general public's chances are of contracting the disease. We welcome back to CITV Mr. Arnell Thomas, Program Manager of Vector Control and Port Health, and Mrs. Jennifer Wilson, epidemiologist. We thank them both for being here today. So according to the daily newspaper, Ms. Wilson, we have two diagnosed cases of the Zika virus on the island. What is the impact of this on the island, and is there any cause for an alarm?
It's understandable that people would be concerned about a potential Zika virus outbreak in Bermuda, but we don't want people to be alarmed.
Okay.
We expected that there would be imported cases, which means travel-related cases, people who travel to an affected country and return to Bermuda with the virus. We expected that, but what our concern is that we don't want local transmission to occur. So rather than be alarmed, we want people to act responsibly and take actions to help us to keep the transmission of locally acquired Zika low.
Okay, Mr. Armel?
Yeah, just like Jen said, we have two right now. It's going to be more, and the main thing here is for the public to react responsibly, so that the local transmission is considerably low.
Okay. So if by chance there is an outbreak, how should we respond to that as a community?
If there is locally transmitted Zika, the Ministry of Health will inform the public and be giving instruction at that time. With imported cases, the instruction at the moment is to continue with what we have recommended in the past, avoiding mosquito bites and preventing sexual transmission after you've had contact with somebody who's traveled to an affected country.
Mm-hmm. And so I'm assuming if you're pregnant as well, these factors need to really weigh in very heavily.
The biggest risk, of course, is the pregnant woman because of her ability to pass the infection on to the unborn baby.
Okay. And what was that term called, the NIA?
Microcephaly, or smallness of the head with abnormal brain development.
Mm-hmm.
So that's the biggest risk.
Okay.
Usually, Zika is a mild illness,
right.
With 80% of people having not having symptoms, and maybe only 20% having symptoms or not even realizing that they have it.
Okay. So as I was telling you in the pre-interview, I was watching the American news, and in Miami, that's one of the hot spots for the Zika virus. The children have already gone back to school, and they were asked to wear long sleeves and long pants. Now, if you know Miami, temperatures daily in the 90 degrees at least. What is your reaction to that? Is that going to happen here in Bermuda with our children going back to school in about some kids have already gone back to school.
Yeah, all depends. Based on the fact that the mosquito that we do have has a potential to carry the Zika virus. Mm-hmm. But again, all depends on the risk factors and what stages we are at. Then we actually educate the public what stages to move forward. Mm-hmm. At this particular moment, we don't need to do that as yet.
It's not at this time.
No, but we still need to protect ourselves. I don't want us to sit back here and get too relaxed to say that because we don't have the actual Aedes aegypti mosquito that carries the dengue, carries the Zika, carries chikungunya. It's not in Bermuda, so we can have a party. No, we've been acting. We have to act responsible, regardless of what bites we have.
Okay, definitely agree. Does the Zika virus affect children and adults differently, Ms. Wilson?
Both children and adults can get the infection, and as far as we know, they get similar infections. So they can either have a mild illness or not have symptoms the same. The big distinction is with unborn children being affected through pregnancy. So, of course, the microcephaly and other neurological problems. And there's also that risk of Guillain-Barré syndrome, which is a neurological disorder. So both adults and children can be affected by that. So I would say the answer to that question is both can be affected similarly, except for the microcephaly in the unborn baby.
Okay. And can pets be affected with the Zika virus?
That's a brilliant question. The mosquito tends to want to get to pets first for its blood meal, and then humans later. At this particular moment in time, I can tell you that cats and dogs, we don't have any sort of scientific background if they actually can carry the Zika. What I do know is that the primates can actually carry the Zika, which the primates are human being first, apes and all of them second, and then thirdly, monkeys. So we do know that they can carry the Zika virus. I'm pretty sure that also that the rodents can carry Zika virus as well. So right now, like I said, I'm not getting excited or I'm not going to put the public at alarm. As long as we can continue to do the right things, tip out water and those things there, will be a great help to us. But at this particular point, I don't know of any or seen any scientific background on cats, dogs, personal pets getting the Zika virus.
Okay.
And
Go ahead.
there hasn't been any evidence of transmission of Zika from pets to humans.
Okay.
So there's no evidence of that at this time.
So now the name of the mosquito that's causing all this havoc is the Aedes
Aedes
type.
aegypti.
Aedes aegypti. And we know for a fact that this is not on the island. How do we know this?
It's a good question, another good question. Basically, what we tend to do, we have 600 OV traps. Those are like egg traps. Aedes aegypti and Aedes albopictus, they actually lay a single egg. So they don't lay all the eggs in one basket. We have also Culex and salt marsh mosquitoes. They lay rafts of eggs. They lay like 200 eggs in one go. So every week, our team at the Vector Control, they actually go out every Friday and collect sampling of these points. So those particular points are looked under the microscope and we're able to determine what eggs are here. We also work with, for background, we also work with a university abroad that has a student here now. They normally will come in the fall. And we also have double checking to ensure that what mosquitoes are here or not.
I think also it's important to note that although we don't have a gypsy, we do have albopictus, which is in the same family and does have the potential for spreading the infection. So we still want people to take the adequate precautions because of that potential.
All right, and just go over those precautions again.
Yeah,
You wanted to add something? Go
Yeah, I
ahead.
want to add this here. It's like going to the grocery store. When you buy chicken, just think that you have chicken has salmonella in it. So when you cook it, this is why sometimes we say always cook your meat medium, not medium well, but cook
At
it.
least a medium, yeah.
Cook it to at least 165 Fahrenheit. So it's a well-done hamburger and those types of things there. So always think that your meat is contaminated with some sort of bacteria. The same way I'm going to tell the public, if you get bitten, always think that, we want to make sure that, ensure that people don't get bitten. And what we try to do in Bermuda is basically eradicate the mosquito at the larvae stage. What I mean by that is not an adult. So the few adults that we do have, we try our darnest to try to eliminate it at the larvae stage.
Okay. Now, I was watching the American news, and so we were actually watching something similar about the gentleman just fogging, and we don't do that here in Bermuda, or do we? I haven't seen that. You can answer that.
Yes and no, we do.
Okay. I wasn't aware.
In Bermuda, we tend not to fog around the homes. Why? Because we have sustainable development for our roofs. We catch our rainwater. We drink our water.
That's true, yeah.
So in those particular areas, I wouldn't fog. We only fog if marsh areas and those types of things there if we had to.
Oh, heavily concentrated.
In this particular areas, yeah.
Oh, okay.
So, and again, we're looking at soap marsh mosquitoes. They're really, really big, and they become a nuisance at times. So we will fog in those particular areas. But we don't have, we're not set up like other jurisdictions have. They actually wait for the mosquito to become an adult, and then they send planes over there throughout the country fogging. We can't do that.
We can't do that because, as you mentioned, because of our water system and so forth.
Yeah, because we collect our rainwaterfall, and then if I start putting in larvicide into our water system, that's a whole nother ball game. Because the larvicide basically reduces the mosquito from becoming an adult, the larvae from becoming adult.
Okay.
So that can actually be very detrimental to pregnant women and others.
Okay. So we only have a couple more minutes in this segment, but I wanted to ask, people are going to travel. That's just a known fact. What are we doing to curtail the importation of the mosquito, that particular Aedes mosquito, into the island?
I'll let Armel speak to that, but I'd
Okay.
like to speak to what we're trying to do to curtail further importation of the illness into the island,
Okay.
which is advising people before they travel to check to see whether the country they're traveling to has ongoing spread of Zika. So that's
Okay.
before they travel. Find out what precautions they should take. Make an appointment at the travel clinic, 278-6460,
Okay.
so that they can get further advice, because other than Zika, there might be other travel-related illnesses
Right.
that they need to take precaution for. When they travel, take mosquito precautions by wearing mosquito repellent, by wearing light long sleeves, by, if they are outside camping, permethrin-treated clothing and gear, by sleeping in screens and air conditions, and preventing sexual transmission. The other precautions they should take once they return is to continue wearing the repellent so that we don't infect our mosquitoes here in Bermuda, and to continue with preventing sexual transmission.
Okay. We're going to take a break right now. When we come back, we're going to find out what else we can learn about the Zika virus and how we can better protect ourselves. We'll be right back. Stay tuned.
Healthy people and healthy communities.
There, airline tickets are booked. Pack your mosquito repellent and call the travel clinic.
Travel clinic?
Yes, some destinations require a visit to the travel clinic to prevent certain food, water, and mosquito-borne illnesses. Make an appointment 2 months before your departure date and bring your immunization record and a list of your medications. For more information, call 278-6460.
Brought to you by the Bermuda government, the Ministry of Health.
Welcome back to Health and Family. If you're just joining us, we are talking with the nurse epidemiologist as well as vector control, Mr. Armel Thomas, about protecting ourselves against the Zika virus. And so we left off, you were talking to us about how to protect ourselves and what we need to do. I wanted us to go into some of the countries that currently we know definitely have the Zika virus. I mentioned Miami earlier, that's not a country, but the United States. What other countries or regions can you tell us currently have the Zika virus?
For the most part, it's the Caribbean and Central and South America.
Okay.
There is an area in the Miami area that has had local transmission, but remember, Florida is a big place,
Right.
And mosquitoes aren't great flyers. So at the moment, it's a limited area in Miami. So it's important for people to check the CDC travel website because those areas are changing almost daily, definitely weekly.
I think New York was actually added to that list the other day. They have quite a few cases there. And so how is the Zika virus diagnosed? I'll come to you to that.
In Bermuda, we have access to a blood test. It is sent abroad to a reference lab because CDC validates certain labs to do the test. And that blood test could be done either through the Department of Health or at King Edward.
Okay. How long is the incubation period for the Zika virus?
About 3 to 12 days after you've been bitten by an infected mosquito. If you're going to have symptoms, then you would have symptoms after those, up to 12 days after you've been bitten.
And the symptoms are?
Like, remember, most people don't have symptoms. So 80% of those people won't have symptoms. But for the 20% that have symptoms, it's fever, rash, joint pain, muscle pain, headache, and red eyes. Those are the usual symptoms.
There is currently no vaccine. Am I correct in saying that? I'm sure they're working on it feverishly.
Yes.
And so, if one does contact it, what should one do immediately if the nurse says, "Listen, you have the Zika virus"?
Firstly, if you're having the symptoms, then consult your healthcare provider. So that guidance has not changed. Your healthcare provider will assess you and decide whether they feel that their symptoms are consistent with Zika. Because remember, there are other illnesses that you could get, and even mosquito-borne illnesses such as dengue and chikungunya when you travel to those places. So I would say consult your healthcare provider first and foremost.
And so, if the public suspects somebody else of having it, and I'm not saying that in Bermuda, where sometimes we just get into people's business. What should we do? Do we call you guys up? You gave us a phone number earlier, and say, I think person A may have it.
I would advise that person speak to the person and advise them to seek medical advice.
Okay, and I think
you can't make people seek medical advice, but at least advise them to seek medical advice because they may not even be thinking of Zika virus when they experience the symptoms.
Okay. I wanted to come back to you, Mr. Thomas. As far as the awareness, the campaign awareness, do you think we're doing everything we can, in your estimation?
Yeah, we're doing a good job. But never, it's never enough for other people. So what I want to say is that I want to thank our team at the health department. And it also includes, all of Bermuda. We have to take a collaborative approach about this. We can't just allow a team of 20 people to eradicate Zika in Bermuda. It has to take a conscious effort throughout the whole country. So we have other non-governmental agencies that help us, like KBB. We have the international private sectors, which they actually get a group of people and they go out and picking up trash as well. We also have Works in Engineering. They pick up the trash twice a week. So what happens, just a cap full and a chip bag blowing around in the trees could cause a lot of damage to us. So it's important for persons to put out their trash the day off if they got barrels to cover it because birds are inquisitive.
Okay. I'm glad you brought that up because realistically, people try to do that, but as you said, the night before, even the morning of, the dogs and the cats get into this and spread it all up and down and makes a big mess, and I'm sure the mosquitoes are getting into it as well. And so you can't really blame the public for that. We're doing what we're supposed to do. Have you guys ever thought about providing us with bins that we can put the garbage in?
Unfortunately, I can't speak on behalf of Works in Engineering,
Okay.
but that's something that they should take an approach like what the government post office did in regards to mailboxes. So I think they should probably look at something like that. It will really help us as well. Yeah.
I would say that we've promoted the information in various sources. People can seek the previous press releases that we've put out. They should look at the government website, www.gov.bm, for updates. And international sources for information are CDC, or Centers for Disease Control, and the World Health Organization.
Yes. Are you guys going to be doing an education with the children when they come back to school? Is that something on the agenda?
Sure. I mean, we actually do that now because you got to remember, 2 years ago was chikungunya. This year is Zika. Next year will be something else. So our program is structured in a way that we can't wait around for something to come out. We have these surveillances in place, and they've been in place for some time, not just like yesterday or last week.
I know the public sometimes can go crazy, but I think it's better to err on the side of caution than looking back and saying, "Gosh, I wish I had" or whatever.
Yeah.
So yeah.
So we tend to get to the schools as soon as schools in September when they get back in, we go to assemblies and ask them simple questions. Also, we have a game out called Zapaquito. I think I made mention of Zapaquito before, and Zapaquito is Zappy mosquito, but they take off mosquito, but Zapaquito. So every time you actually zap the mosquito,
This is online.
it's online. You can actually download it, but every time you zap the mosquito, it actually brings up history about the mosquito, how to how to avoid, how to do certain things.
Zeppa keto.
Zapakito.
Okay.
Yeah.
Okay. And so, as far as us being able to deal with this, because you're going to have fear among people, what are you doing to allay people's fear regarding this?
I'll tell you what, I mean, we have a fantastic epidemiologist surveillance unit run by Jennifer, and she can possibly tell you what we do, and then I can actually continue on from there.
Sure. The public should know that the Epidemiology and Surveillance Unit are aware of what's happening in Bermuda in reference to Zika virus. Healthcare providers are required to report any suspected cases and confirmed cases of Zika to our unit. As well, if they are seeing syndromes such as fever and rash, because remember we spoke of fever and rash being common symptoms of Zika. So if they're seeing syndromes such as fever and rash, we also monitor those. So we're steadily monitoring and looking for increases in symptoms. I would say that we're allaying fears by keeping the public up to date and letting them know, the efforts that we are taking to prevent local transmission of Zika.
Yeah, I have to agree because you've been on this program a few times. What is the vector control doing to safeguard? I know you spoke about putting our garbage out the night of or the day of, preferably. What else are you guys doing overall?
Also, what we're doing is that when travelers coming back to the country from these affected areas, we have ongoing surveillance at the airport, which they will actually ask certain questions, by the customs officers.
So if they come back from one of the infected areas, are they pulled out and said no? How does that work?
They are asked questions. The World Health Organization has advised that there be no interference with travel or trade related to Zika. So we take our guidance from the World Health Organization, but we do have surveillance in place. So every traveler is asked where have they traveled and are they well? And they are given a blue card if they've been to an affected country that says, see your healthcare provider if you develop symptoms. And I must say, I have had calls from people saying, you know what, I've traveled, I have symptoms, and I received a blue card. What should I do next? And they call my number. So yes, it works that way. And no, people are not pulled aside or isolated or quarantined, because that has not been proven to be effective with a disease such as Zika. So we do take our guidance from World Health Organization and the Centers for Disease Control.
Okay. So the two individuals that were diagnosed, that according to the newspaper, they're not quarantined, they're in their...
They are advised regarding preventing transmission, and on suspicion, a referral is sent to vector control, and vector control increases their routine surveillance. So the vector control is in your neighborhood every day. Every day.
What will happen, what Jan is saying is that if somebody has a suspected case of Zika, we get a referral. Within 24 hours, we have a team working in a 3-mile radius from their house. Because why 3-mile radius? The mosquitoes are a very weak flyer. It can fly up to 2 miles, but we're doing 3 miles. So we send a team out to do a seek and destroy at their home and also where they work. So we have 2 teams out there. And right now, every Wednesday in Bermuda, we're actually combing through the whole island, each home, looking in your yards to see what's going on. So we're turning pots and things over.
And so that's when the standing water and all that, that
right.
needs to be dealt with.
So we're increasing from that aspect. Got to keep in mind that we have no local transmission in Bermuda. So in order for us to continue to have no local transmission, these are the things that we have to do. And we're just asking the public to assist us in buying that. Yeah.
And so, Mr. Thomas, any final questions? We are about to finish.
Sure. The only main thing that concerns me is we have a plant in Bermuda called bromeliads. Bromeliads holds a lot of water. If persons go to the health department, we're going to remove them. So if we're finding breeding in them, we're going to remove them.
Okay, I think we're going to have a picture of that so everyone can see what we're talking about.
Sure.
Okay.
So I just wanted to make mention on that.
All righty. Thank you so much, both to you, Ms. Wilson, and to you, Mr. Thomas. We want to thank our guests from the Vector Control and Port Health as he is the program manager, as well as a nurse epidemiologist, Mrs. Jennifer Wilson, for educating us on the seriousness of the Zika virus. It is hoped that all of Bermuda will take heed to the advice given by these experts to minimize the effects of this disease. On the behalf of the Health and Family team, thank you for joining us.